Today we're going to be talking about sensory impairments, and more specifically, hearing impairments. This information is going to be presented by Tala Abou-Dahech,
Lisa Snyder,
and Megan Phillips.
All right, let's get started. A sensory impairment is more of an umbrella term. It talks about when one or more of the senses is impaired, so this can include your sight, hearing, smell, touch, or spatial awareness. What we are going to focus on today is hearing. And a sensory impairment does not necessarily mean that it is a total loss of that particular sense, so it can be partial and different levels of severity as well. So a hearing impairment is a partial or total inability to hear, and this may occur in one or both of the ears, and severity ranges from mild to profound. And this chart just shows the different frequencies and the decibels that it affects. There are three general types of hearing impairments, so that can be conductive, which impacts the outer ear or the middle ear. There are sensory neural impairments that come from the inner ear being impacted, and then mixed impairments, which is a combination of the conductive and sensory neural aspects. The different types of the different parts of hearing impairment can be caused by different causes. So conductive hearing impairments can occur by different allergies, ear infections, poor eustachian tube function, perforated eardrum, any malformations of the outer ear canal, or middle ear structures, fluid in the middle ear, and there are other, but these are some main causes. And then sensory neural hearing impairment, which can be caused by malformation in the inner ear, exposure to loud noise, head trauma, aging, genetic factors, tumors, and there are others. And then for a mixed hearing impairment, it can be a combination of either these conductive causes or the sensory neural causes. Regarding prevalence, 1.2% of students receiving special education were classified with having hearing impairments. About 10% of the U.S. population have a hearing impairment. 3 in 10 people over 60 have hearing loss, and it is estimated that about 3 in 1,000 infants are born with severe to profound hearing loss.
There are many general symptoms of hearing loss. Infants by 6 months, if the child does not startle or is not soothed by voices, does not turn to sound, or does not respond consistently to sound, they may have a hearing loss. At 12 months, if there's no response to their own name, no response to household sounds, and does not localize to a certain sound, that child may also have a hearing loss. And by 15 months, if the child does not imitate sounds in simple words, a hearing loss may be present. Some other general symptoms include, for toddlers through adults, muffled hearing, asking for repetition, tinnitus, difficulty attending, difficulty understanding speech in noise, turning the volume up on the television or when listening to the radio for music, thinking others are mumbling, difficulty understanding speech on the telephone, difficulty understanding speech of women and children due to their high pitch. They may make rhyming mistakes, or hearing the high-pitched sound T in the word tin as an F sound, such as in the word fin, isolating oneself, or speaking too loudly or too softly during conversation. There are also many symptoms related to language or communication in the areas of semantics and syntax. For semantics, a child can learn concrete words such as red, car, for, and push, but function words like the, an, are, and a, and abstract concepts are difficult to grasp. The vocabulary gap widens with age, and words or phrases with multiple meanings may be confusing. In the area of syntax, Grammatical morphemes may be delayed, such as past tense ed, plural s, possessive s, and present progressive ing. These endings are not stressed in a word at the end of the word and are spoken with less intensity and loudness. They may produce shorter and simpler sentences and have difficulty understanding and writing complex sentences. A relative cause, such as the teacher whom I have for math was sick today, or in the passive voice, the ball was thrown to Mary, may be difficult to understand. Symptoms related to pragmatics include missing out on subtle aspects of communication in groups, difficulty following figurative language, such as idioms or other humor, difficulty negotiating with peers, difficulty initiating communicative acts of others, and difficulty navigating structured turn-taking conversations. In phonology, the child or person with the hearing loss may have difficulty hearing quiet speech sounds, such as sh and k. The development of sounds may not occur. Accuracy of production decreases. It affects both vowel and consonant production, and the person with the hearing loss may have poor intelligibility.
Okay, so some factors to consider before going into intervention would be making sure that the child or adult, whoever is going to be receiving intervention, has auditory access. So whether that be the use of hearing aids, assistive listening devices, or even cochlear implants. But this is family decision. They decide what is best for them. So that may even be including the use of sign language or speech reading. And after these factors have been considered, they'll receive a comprehensive speech and language evaluation to identify target areas for intervention. So for children in early intervention, just to highlight some intervention techniques, it's very emphasized on being family-centered. Families are educated about typical speech and language milestones in development, and a heavy emphasis on parent training as well and getting the parents involved in intervention. Most children born with hearing impairment are born to hearing parents, so auditory verbal therapy is a popular technique, and it emphasizes learning through verbal speech and not signing. So this intervention focuses on verbal language alone. For preschool, which would be 3 to 5 years, continuation of intervention into the school years is essential. And you teach the child compensatory strategies when complete remediation is not an option. So some conversational repair strategies that they can use while talking to other people. Emphasis on early literacy is also very important during the preschool years, so making sure that you incorporate phonological awareness into your intervention. Dialogic reading, which we'll see an example of here in a couple minutes, is also a very popular intervention, which is to promote oral language skills in children. And even signed letters can be used as cues for writing. Some other general techniques using video feedback, taking video during the intervention sessions and reviewing it with the parents, and it can identify progress through intervention. Language models, having the parents be a model for their child or even using peers. There's also been progress seen with helping parents having parents go to support groups for other parents with hearing impaired children, or even learning to sign if that is something that they choose to do. Also making sure that they consider environmental modifications, which would be to minimize background noise and even provide audio-visual signals to ensure that hearing is maximized. With slightly older children, when we get to the school age years, you want to have more push-in intervention within the classroom. and helping the child to function within the classroom, collaborating with the teachers, really getting the teachers involved. Could be even using assistive listening devices like an FM system within the classroom. And some other strategies such as decreasing the distance from the child, maybe having them sit it up front. Determine what the child is actually hearing as well, so giving them reflective questions, asking them what exactly they heard and we can use that as a starting point to build on their residual hearing and know what they're actually hearing. Also self-advocacy and communication repair techniques, so asking for clarification or asking people to repeat. And some other general techniques, using role play as a means to teach abstract language forms such as idioms or slang. Also learning new vocabulary through context, using stories to help learn new vocabulary, and educate the child about their own hearing loss and what strategies they can use during conversation or in school to help maximize their own hearing. With adults, this would be anyone 18 years and above. So this intervention usually involves use of repair strategies. So again, asking the speaker to repeat, simplify, rephrase, or use key words when they're speaking. Video feedback is popular with adults. So actually videotaping the client, and this works well for articulation, and they can see how they're producing a sound, and then maybe even providing a model either through a video, a peer, or even an examiner model to show the typical way to produce that. Some other general techniques, again, environmental modifications, minimizing background noise, reducing the distance from the speaker, having eye contact with the speaker, and having good lighting. Again, educating the client about their own hearing abilities and being aware of their limitations.
Alright, so some general communication outcomes for a person who has a hearing impairment. Now, these are not for every case, so each case is going to be different, but these are just some possible outcomes that may occur. So some main ones include a delay in receptive and expressive speech and language. So they may have learning difficulties in the classroom, social isolation, and it may impact their vocational choices later on in life. So regarding speech, if they cannot hear specific sounds, such as the sound, they might not be able to produce it as well. They're not producing what they cannot already hear. And then they also may speak too loudly or not loud enough because sometimes they cannot hear their own voices. Regarding morphology, they often don't hear certain words ending in that, such as the present progressive or the past tense ed. And so if they don't hear those, they might not pick up on those morphological structures, and they might misunderstand a verb tense, pluralization, or possessives. Regarding syntax, they might not understand or they might produce shorter and simpler sentences than those of their same age peers, and they may have difficulty understanding and writing more complex sentences. Regarding semantics, their vocabulary may develop more slowly than their peers. It's a lot easier to learn concrete words for them than those abstract words, and that gap between vocabulary of children with normal hearing and those with hearing impairments continues to widen with age. So they might have difficulty understanding more words, understanding words that have multiple meanings as well. Regarding pragmatics, they often report feeling isolated in school, people who have a hearing impairment, and socialization with their peers is oftentimes limited. So regarding overall academic achievement, they achieve 1 to 4 grade levels lower than their peers with normal hearing. So this is very important. Early intervention is very important for this population. Those with severe to profound hearing loss usually achieve skills no higher than 3rd or 4th grade level, and that gap in academic achievement continues to widen as they progress through school. So again, this is why intervention overall with children with hearing impairments is very important. And here are our references.